please don't be afraid to come to the front. It's the last session of a very long week. For some of you, it won't be full, so do please to come along. Yeah, okay. So we'll make a start anyway. Good morning, everybody. I recognise for many of you this is the last session of the week, and thank you very much for joining what I think, personally, from our perspective, one of the most important sessions of the week. So we save that to the last. What we are talking about fundamentally here this week is, today, is very much about the interaction between poverty reduction, social inclusion, and the role of the transport sector. And so why are we doing that? And so maybe firstly, before I do that, I can just introduce who on earth is talking to you. My name is Jeff Turner. I'm a social development consultant to the ADB. I'm also an independent transport consultant who specialised in the interaction between transport and poverty reduction, social inclusion for many years. And I'm also a visiting professor at the University of Leeds Institute for Transport Studies. And I just wanted to briefly set the scene of why we would be talking about the interaction between poverty reduction, social inclusion, and the transport sector in a forum, in a space like this. But I think there are many things that we can agree on. And one of those is that we as transport professionals in the transport sector, we know we can agree that transport investments can make a substantial and significant impact on poverty reduction and on social inclusion. And we can agree that examples like improving road safety and reducing road crashes, which reduces the burden on people of the loss of loved ones, the trauma and the impact of that, but also the loss of household income, the long-term costs of disability from road crashes or long-term health care, and the impact on households that may not be poor of driving them into poverty as a result of that crash. The impact that delivering barrier-free public transport access has on the transformation of daily lives of people with disability, and the impact of delivering reliable all-weather access to rural communities, enabling access to basic services of health, education, market opportunities, again, as transformational. I hope we can all agree that the transport sector plays that transformational role in that. We can agree, I think? Yes? Yes, okay. But we also can agree that at our national level and our global level, that national transport policies frequently talk about accessibility for all, access for all. This is also reflected in our national government policies around reducing poverty and economic development. It's also reflected in institutions like the Asian Development Bank in its contribution to poverty reduction. There's a very nice exhibition in the ADB library, if you had a chance to look at, its headline is Fighting Poverty Across Asia and the Pacific. We also see that as a key function of the institution. We also see in the global community, if you look at the Sustainable Development Goals, in those impacting on transport, you see access for all. And what do we mean by that? However, whilst we can agree those exist and those are our sector objectives, interventions, actual individual transport investments, unless there's an explicit focus, a particular design focus on the role transport has in reducing poverty and social inclusion, then there is a risk of reinforcing and re-establishing inequalities, over-focus on private motorisation of private vehicles, over-focused on that individual mobility versus walking and cycling or public transport, a focus on large freight flows of large business versus micro and small enterprises. So these, some of these inequalities and the inability for people with disability to be able to access public transport, walking environments, key services. So there is that risk. And so what this session will do, will showcase how poverty and social analysis as a process, as part of the ADB due process and due diligence process, can be a tool that can help the transport sector enhance the impact of transport investments on reducing poverty and tackling social exclusion. And it will also draw examples from live ADB projects that can, as examples, and that can facilitate our discussion. I very much hope that we will have time at the end that actually we have a facilitated discussion amongst you all, not just the panel, of how we can adapt this into to the workings of the transport sector. So on that basis, just to give you the range, this is going to be a hybrid session. So we have a number of people joining us online to present, and we also have people in the room. We will firstly take a presentation from Dr. Gohar Todevojsen, who will talk us through the poverty and social analysis enhanced process within the bank, and then we'll take project cases from Ulaanbaatar BRT. We will take an introduction to a live project in Karnataka in state in India from Wilson Paxiong Lang, and we will also then take the PSA analysis work that's being done in those projects, and then finally we will open to the floor and your contributions and your experience that can bring to this discussion today. Just whilst you listen and think about your engagement, I just wanted to share some possible thoughts that we can think about as we go through of how we can prioritise poverty and inclusion investments, the data and tools we may need, the skills we may need, but also other thoughts that you all are valuable contributions to them. So I will call on Dr. Gohar Todevojsen, if I may, who's a history of being an academic sociologist in the University of Yerevan in Armenia, but is also our lead focal for the poverty and social analysis within the ADB. Gohar, thank you.
Thank you, Jeff. Good morning, everyone, and welcome to ADB. As Jeff mentioned, this is not our first session in a transport forum. We already had a similar session 2 years ago, where we discussed with our colleagues from DMCs the poverty reduction and inclusion issues in a transport forum. And taking this opportunity, we also would like to present and discuss our enhanced poverty and social analysis, and we call it short PSA, and the new classification system, and explain how it contributes to a better or quality project design and how it ensures the proper and inclusive design of our operations, including in a transport sector. So the poverty and social analysis, it's a core analytical tool and a due diligence process in ADB. And we conduct this due diligence, it's an ex-ante due diligence. We conduct it at the project concept and design stage. in order to identify the potential impacts of our operations on the project beneficiaries with a focus on the poor, vulnerable, and socially excluded groups, and to adjust the project design in order to improve the opportunities for this group. It's a tool which allows us to better understand the socioeconomic, socio-political, and institutional context in our DMCs, and it also helps us to set a scene for further detailed analysis, and it also provides a background information for other due diligences, social due diligences that we conduct at ADB at the project preparation stage, such as safeguards, gender analysis, economic analysis when it comes to affordability and willingness to pay. If we summarize, we can say that it's a design tool. Poverty and social analysis, it's a design tool, to help us to improve the design, to make it more proper and more inclusive. So this enhanced methodology or enhanced PSA, and we call it enhanced because in the last few years, we started to revise the methodological approach to better capture the multidimensional poverty, vulnerability to poverty, and also social exclusion. And we also revise our classification to better inform ADB's corporate results framework indicator on the poverty reduction and inclusiveness. So this enhanced PSA, as I mentioned, reflects three key concepts. First of all, it's a multidimensional poverty. So we understand that the income poverty is important. However, non-income dimensions of poverty or access to services are equally important. That's why we emphasize the multidimensional nature of poverty. Second key concept is a vulnerability to poverty. And here we're speaking about near poor. And we are differentiating three main concepts. First one, or dimensions. The first one is the sensitivity to the risks. Second one is exposure to the risks. And the third one is ability or adaptive capacity or adaptability to cope with these risks. And the third group we're speaking in this enhanced PSA is the socially excluded groups. And here we're talking about people who have limited opportunities or participation due to the structural barriers in a society. The PSA, the enhanced PSA, also recognizes the importance of the intersectional analysis because we understand that people experience vulnerability differently due to their overlapping identity factors, such as, for example, people with disabilities. So that's why we do this intersectional analysis to understand how these identity factors impact their ability to access to opportunities. So this enhanced PSA introduced 6 channels of impact through which we assess the potential impact of projects. And it helps us also to identify the project beneficiaries with focus on the poor, vulnerable, and socially excluded. The new classification, the new poverty classification, allows us to consistently track the progress toward the poverty reduction and inclusion results. And overall, or to summarize, the enhanced PSA strengthens the link between the analysis, design, and the final development outcome. In our new corporate results framework, ADB elevated the poverty reduction and inclusiveness indicator as a strategic level indicator by recognizing the importance of this indicator, and set a target of 75%, which means that 75% of ADB's committed operations, both sovereign and non-sovereign, will directly contribute to poverty reduction and inclusion. And the PSA is the methodology behind this indicator, And the new classification is the classification which informs this methodology. So as you can see, this is a very comprehensive and rigorous chain from the analysis to classification and from the classification to the CRF indicator. I already spoke about the importance or about the rationale, but I also have to mention that ADB Strategy 2030 and also the midterm review of this strategy called for a stronger PSA and for a stronger classification, and that's why we started the revision process. And the enhanced PSA and the classification became effective in ADB last year in July. But before we did almost 1.5 years, we piloted the methodology and we enhance it. So these three concepts I already explained. I'm not going to detail more. If you have questions, we'll be happy to take the questions on the concepts. But I want also to speak about these channels of impacts approach. This is not a new approach. It has been there also in the previous PSA. However, we streamlined this approach. We made it more consistent. And now we're talking about these 6 impact channels or transmission channels. We're calling them also transmission channels. So these are employment, prices and wages, transfers and taxes, access, assets, agency, or empowerment. For every single project at the entry point, we analyze the potential impacts through these channels. Not all the channels could be relevant to a single project, so we have to do this analysis in order to understand. And not all channels could be directly deployed or deployed in a project or used in a project. That's why we have to do the analysis of the impact channel's relevance in order to understand whether it's relevant or irrelevant, whether the impact through this channel is direct or indirect. And then we do analysis on the beneficiaries. We identify who will be benefited, who may left behind. And so here we speak, as I said, about the poor, vulnerable, and socially excluded groups, and then we try to identify the risks and impacts, both positive and adverse impacts, and most importantly, opportunities, how the project can enhance the opportunities for the poor and vulnerable to benefit from the project. And we design the project, or we develop design features to enhance those opportunities for the people. There's also another element, which is measurement, and those of you who are familiar with ADB project, you know that we have this DMF as a tool, which is basically a theory of change. And we also include outcome level and output level, depending on the categorization, to measure the progress of the proposed design features. So basically, this impact channel matrix, it's a tool which helps us to summarize our PSA analysis in a matrix form and inform the PSA classification. So this is a new classification. It's a 3-tier classification system. The first 2 categories, which are poverty reduction and inclusion focus and poverty reduction and inclusion elements, contribute to the CRF indicator achievement. So in other words, these 2 are counted toward this 75%, which is a cumulative, by the way, indicator to be achieved by 2030. So when we do the classification, we speak about 4 elements. So the classification is determined by 4 elements. The first one is a type of impact. And for the 2 highest categories, the impact should be direct through some channels of impacts. Second element is about beneficiaries. And again, for the 2 highest, the requirement is that the poor, vulnerable, or socially excluded should represent at least 20% of beneficiaries and in a higher percentage than their overall presence in a population. And for the second highest, the requirement is that they should be present, but they could be less than 20%. If we have a presence of poor, vulnerable, or socially excluded groups, then of course we have to design, we have to come up with some design features in order to maximize the opportunities for these groups. That's why the project should have inclusive design features. And the last element, last requirement is about DMF, design and monitoring framework indicators. For the highest category, we require output level and outcome level indicators. For the second highest, only outcome level indicators. We also have, as a third category, indirect poverty reduction and inclusion, which is equally important as the direct, because some of our operations have indirect impact on poverty and exclusion, and we really want to better capture also this indirect impact and report on indirect impact as well. That's why we have the third categories. I just want to mention just a couple of words that we did a post-validation of the classification last year, and the transport sector had the highest achievement in terms of the proper and inclusive design features, which is very good achievement. And we have been developing, some knowledge products to support our teams, our project teams, and also our counterparts in our DMCs to better understand the PSA. So if you're interested, we can provide a link so that you can also get access to these materials and learn more about the PSA. Thank you very much. I'll stop here. Maybe the questions after.
Yeah. Excellent. Thank you very much, Gohar. And as someone who's worked with development banks and within the sector of trying to have processes where considerations of poverty, of equity, of gender equity, of other cross-cutting themes in development bank processes, to have mandatory processes and targets is a real a step forward, and this unique process to ADB is a major step. So without further ado, I'd like to, as part of our hybrid workshop today, we'll have an online contribution from Emily Wong, who's currently based in Ulaanbaatar, to talk about the work that she did under poverty and social analysis connected to the Ulaanbaatar BRT project, part funded by the ADB. And Emily is online as a hugely experienced poverty and social consultant across a whole range of cost-cutting themes. And Emily, if you could take us to your presentation. Thank you very much.
Thank you so much. Thank you, Michelle, for control the slide. So good morning, everyone. I am Wang Huijuan. You can call me Emily. I came from China, Shanghai. I'm very pleased to share this practical case from this Ulaanbaatar Urban Mobility Improvement Project in Mongolia. And before I start, I would like to thank the Gohar's team, especially Jeff. Before our project start, they gave us a very helpful and detailed explanation and clarify about this 6-channel impact assessment tool. And during our project, we can make it become true, and also from our whole project team's contribution, especially our PTL, Nicole. So my main message today is very simple. It's about a PSA. It's the most useful thing when it doesn't only stop at analysis, but changes project design, indicator, and the implementation responsibility. I'm actually in Ulaanbaatar at this moment. So this case feels very real to me. In the past few days, while working here and also going to the medical appointment, I experienced some of the same mobility constraints described by the local residents. So sometimes I had to give up a trip because I was worried about the traffic. So many times walking becomes the most predictable option, but pedestrian safety is also a road crossing a very real concern. So this is why I don't look at the BRT only as a transport investment. It is also a kind of poverty, access, safety, and inclusion intervention. So this project, it will benefit about 1.857 million residents across 6 districts in the UB city, Ulaanbaatar city. It accounts about 95% of the total population. Among them, about half are women, and about 8% are older people, and 2% are people with disabilities. So the project area is also social diverse. Around 27% of the surveyed households earn less than half of the city's average income. So poor households are also much less likely to own the cars. So they depend more heavily on the public buses. This is the poverty and inclusion story behind this BRT case. So next slide, please, Michelle. Thank you. So the first lesson we've learned from this case is that methodology matters. Yeah, thank you. So the PSA used a mixed measured approach. We had 300 household survey across 12 locations at 6 districts, with more than half of the respondents being women. And we also conducted meaningful participation and focus group from different groups, especially people from disability and low-income households. So, but the survey done was not enough. We also have some key informants interview with the passenger perspective surveys. We even have the journey mapping and focused consultation with women, students, older people, people with a disability, and transport operator like the bus companies and some of the NGO. So these measures have review the barriers with a standard response transport survey may miss. So people didn't only talk about travel time, they talk about waiting in the cold, overcrowded buses, fear of harassment, not knowing where to complain, and the difficulties of working safety or from stops. So my own experience here also reminds me that mobility barriers are cumulative. It's not one single problem. It's traffic, it's waiting time, uncertainty, pedestrian safety, service quality, and sometimes the stress of deciding whether a trip is worth making at all. So the key point is that social funding became useful for design because they were specific, spatial, and discussed earlier at the technical team. So next slide, please, Michelle. So next is about the 6 impact channels. For this transport project, the channels help us to organize many different things into a clear design conversation. So employment looked at the construction jobs, BRT operation job, and access to the workplace, and price and wages. We look at the fare affordability, but also indirect costs such as the waiting time, transfers, and the lost income. So transfers and taxes looked at the subsidy and the concessions. Access looked at the jobs, schools, hospital, markets, and services. Exit looked at the livelihood, vendors, kiosks, and the small business along the bus route. So agency looked at voice, the feedback, grievances, and the readiness, and the users' participation. So for this project, the PSA is classification is the poverty reduction and inclusion focus. It's a PIF. So I would like to explain it in a very simple way. So the project has very direct efforts on poor and vulnerable group. So the beneficiary population includes significant share of poor and vulnerable group. So the design includes specific measures for them. So the DFF includes measures and indicators to check the result. So next slide, please. So access was the strongest poverty reduction pathway in this project. So Ulaanbaatar's mobility barriers are not only about congestion, they affect whether low-income residents, women, students, older people, or people with disabilities can reach the jobs, schools, hospitals, and public service, safety, and reliability. So why important poverty funding is that the difference in the mobility access. So car owners among the non-poor households is about 64%, nearly 3 times the level among the poor household, which is about 24%. As a result, bus use is higher among the poor household, around 56%. So this means unreliable public transport is not only a small inconvenience. For poor households, it directly affects their employment search, time poverty, access to the service, and daily stress. So the project is expected to reduce the commuting time by around 30% on some corridors. So, and to double the area of the city access within 1 hour for residents in the undeserved and low-income eastern area, including the employment sites, hospital, and schools. So the slides also show that project responds to nearly 30 kilometers BRT corridor, 90 stations, and a travel time reduction target of at least 30 minutes for the selected low-income trips. The DMF and design response also include universe design and personal safety for anti-GBV criteria. So next slide, please. So in many of the transport projects, affordability is discussed mainly only the fare level. But for poor and vulnerable groups and users, real affordability is broader. So the PSA, we found that household spending on the transport was around 4 to 5% of household expenditure. And less than half of surveyed households said current bus fares, together with spending on more expense of the informal transport options, were easily affordable. So the passage survey figure is around 47%. So average bus waiting time was about 20 minutes, and in some cases, much longer. So when we talk about affordability, we need to include the fare time, transfers, and reliability and safety. So a cheap fare is not truly affordable if the bus is unreliable. If the trip requires many transfers, or if people have to pay for informal taxi and because they feel unsafe or cannot wait. So the project, the response to is therefore not only about keeping fares low, it's about reducing travel time, improving the reliability, protecting existing transfers and subsidies, and maintaining coexistence for the groups such as young people, older persons, and persons with disability. So next slide, please. Thank you. So this slide is bringing together about the employment, safety, agency, and inclusion. These are sometimes treated as soft issues, but the PSA have converted them into the codified commitment. So on employment, this project is expected to create about 1,200 to 1,500 direct construction jobs for the local residents, including women. And it also creates about 600, 800 job opportunities in BRT operating during the next stage. So the PSA also looks at inclusive hiring practice for the people with disability and the local residents. So a key baseline was that women were only 3.7% of bus drivers. So the project's response is not simply create jobs, it's also to make the transport workforce more inclusive, including the targets for women's employment, internship, and returning. So on safety, the findings were very clear. Women and girls raised their concern about lightning, harassment, and weak reporting channels, safety around the stops and the vehicles. So the project therefore includes accessible stations and buses, lighting, CCTV, station design, anti-harassment measure. So at least 90% of the BRT buses and the stations were expected to meet the highest standard for the universe access, personal security, and gender-based violence criteria. So our agency, the PSA, found weak complaint mechanism and low trust in the follow-up. So the project moved from the general complaint idea to service standard. Example, the apps, the hotline, local GM offices at the target that 90% of grievances are resolved within 7 days. The BRT managing authority, the staff also need to training on gender and accessibility inclusive operation. The key lesson is that employment safety and voice can be made measurable when the consultation evidence is linked directly to our DMF and the other action plan in the plan. Next slide, please. The asset channel is also especially useful for risk management. So during preparation, the Ulaanbaatar has studied a wider municipal fiscal relocation campaign across 6 central districts. So this action is not directly caused by our ADB financed project, but the PSA will help to framing this correctly. So we didn't automatically attribute the citywide relocation to the project. At the same time, we didn't ignore the potential livelihood risks. The access channel asks whether these vendors, kiosks, or informal business could still be affected with the BRT footprint, especially during the construction. So these actions were therefore very clear. Firstly, they conduct the resettlement due diligence before the construction. Second, if residential impacts are confirmed, prepare a corrective action plan with mitigation or livelihood restoration. And then thirdly, the monitor implementation so that the project delivered doesn't proceed with unresolved social safeguard risks. The next slide, please. This is also the last slide. Okay, so I will close with main operational lessons. The social development action plans work best when they are not only treated as separated entities or a list of good intentions. They need to be mainstreamed into the project delivery system. So in this case, the evidence comes from the surveys, focus group discussions, key informant interviews, journey mapping, passages, survey, and accessibility analysis. The 6th channel helped us to structure the analysis, but the real value came when the findings were embedded into the DMF, into the Gender Action Plan, and the POM, and the project management arrangement. So the DMF carries the quality-linked indicator in our projects, such as the travel time reduction, universal design, affordability, and the grievance response. So the GAP also carries gender responsive safety, employment participation, and employment actions. So the POM carries institutional responsibility, including the social and gender expertise, monitoring, reporting, and budget. So this is why also why the PIF classification matter. It's not just a label in the project document. It also be reflected in the design, in the beneficiary targeting, in the indicator, and the implementation accountability. So my final message is that PSA is not only an assessment tool, it's a bridge between the social evidence and the project accountability. So the good and the practical PSA to help the team to decide what to design, what to measure, who is responsible, how to follow up during the implementation. Okay, that's all from my introduction. Thank you.
Thank you, Dr. Wang. That's really helpful. And I'm conscious that some of the travel problems you mentioned also affect the fact that you're on your way to the airport, as many of us probably are later today. So we will take questions on Dr. Wang's presentation at this stage and then allow her to get off. So any questions or any comments about this at this stage. Any questions, anybody? Yes. Yeah.
Thank you.
There's a roving mic there, if you could use that.
Thank you so much, all of you. Okay, there are risks. I just wanted to, and there are projects where anticipated impacts are not evident. We know that. And but where, from your understanding, what the risks are and how can they be mitigated? One of the risks, for example, is the migration, for example. That diminishes some of the impacts. Thank you.
Hi, thank you for your question. Firstly, let me repeat your question if I understand it correct. So you are talking about some of the unanticipated impacts related to social we have met, how to solve that, right? Margaret.
Sorry, the microphone wasn't working, my fault. I was talking about the risks. Okay, we've seen a lot of good examples, good impacts from the project, social impacts, economic impacts, but also there are risks. So in your undertaking of the projects, what risks did you encounter and what do we learn from them? Thank you.
There's negative risks in that sense, I guess.
Okay. So the many impact is related with different groups when they facing the barriers about commuting and go out. Not only, for example, in our project, we have a lot of people living in the low-income area. So when they come in, they may have some impact not only for their commuting, but also for their income. If they don't have enough time to go to work or enough opportunity to go to work. So that's a kind of risk specific for this kind of low income groups. And also we found the, like I mentioned, channel assessment. Because in our BRT route, we found that there's existed project of the domestic who is doing the overall campaign of relocation, the small business along the main route. So it's not related with our it's not mainly caused by our project, but they may have some potential risk during our project construction. So we doing the risk assessment during our PSA and providing our funding to the safeguard team to do the mitigation measure. Sorry?
Yeah, that's excellent. Thank you. Excellent. Okay. Yeah, there's one question and then we'll move on. Was there a question over here? No.
Yes, hi. My name is Zofia Bakhtibekova, and I am the gender specialist. I also work with ADB and others. And I know that the PSA is a new sort of tool that's being introduced right now, but I think, and I have used it in several projects, but one of the issues that we usually have when working on the PSA is the availability of data. And that is sort of an issue across various sectors, including transportation. And again, there is, of course, the baseline data that we collect when designing the project, but then there are some sort of specific information that's missing on the country level, especially when it comes to people with disabilities, elderly, and etc. So my question, I guess, is how do you sort of work around that? And is there any sort of way to include it at the design stage, do you think? Thank you.
Oh, thank you, Sophie. That's a very good question. It's a big challenge to get the baseline or the collect the data. So our project, this BRT project, is very lucky because we did many household surveys, very route works to collect the baseline, including our different groups. And we did many kind of survey and focus group discussion. And we also have our national partner to collect many of the country level information for us. So I quite understand your concern, and I also met that situation in other projects. It's a transport project also. So for me, my experience is that to cooperate with our, in that project, I'm the PSA specialist. Actually, I have a gender consultant as a local partner. So we work together to conduct the poverty and social PSA together, and including gender. And also because we don't have very big size survey, household survey, so we also work with the resettlement team and also the environment team, because all of these team, they also conduct some of the consultation or social economic survey in the project area, because that is the bypass project. It's very clear about the people who are directly impacted on this project. So we can get some information from them. We also gave the questions from our PSA side to include it in their resettlement team and the environment team to collect some of the information for us. So I think it works. It's okay. At least we can complete our report and according to the 6-channel impact assessment. But if we want to get more detail, maybe in the future, it still needs some of the PSA specific household survey. That would be more helpful, especially for the vulnerable group, people with disability. We also get information from the resettlement team and the local partner. The country, they have a kind of a database, and when they're doing the resettlement survey, the people will double check if the affected people are belonging to, are included in the database. They have such kind of system, so we can also get more information from their survey result. So that's from my experience, and I hope it's helpful for you.
Thank you.
Thank you.
Thank you, Dr. Wang. Yes, go how you want to.
Yeah, I just wanted to clarify that PSA is not a new tool. ADB has been conducting PSA for many, many years. And the first handbook that was published on the PSA in ADB was in 1994. So ADB has been always has always tried to understand the poverty reduction and inclusion impact of its operations on, across sectors, all sectors, and across regions. Now we're talking about enhanced PSA because we did some revisions in the methodology and also in the classification system. But the PSA as a due diligence, as an ex-ante tool to understand the impacts and to identify beneficiaries has been always there. Thank you.
Excellent. Well, thank you very much for Dr. Wang. That was a really helpful presentation. Thank you very much. And safe travels. There we go.
Thank you so much.
Thank you. Okay, so I'd like to call on Wilson Pak Sung Long, for transport specialist from the ADB, to introduce us really to his project as project team leader in Karnataka State, India, and then perhaps lead us into the presentations from his PSA consultants. Wilson, thank you.
Okay, thank you, Jeff. Can I have my slides, please? Oh, yeah. So, good morning, everyone. My name is Wilson Leung, Transport Specialist of the Transport Sector Office. So today I'm going to briefly talk about the Karnataka Rural Road Improvement Project, which I'm currently processing with the government of Karnataka. So this project focuses on strengthening rural connectivity across the state of Karnataka with an emphasis on improving access, resilience, and safety. So at a glance, you can see this screen here. KRIP, which is this project, is a 345 million investment loan to support the Karnataka Rural Development Agency. The project will cover cover all 31 districts in Karnataka and aim to construct and upgrade about 5,000 kilometers of rural road in the state. So these roads are actually part of the state's brought the district rural road plan, which prioritized connectivity to essential services such as education institution, medical facilities, and administrative centers. So currently, many roads in Karnataka are in poor and uneven condition, which obviously affects all-weather access and reliability. So this project is not just about building roads, but also about improving the quality and functionality of the rural road network so that it can help and better support daily needs and economic activities of people in the state. So the project currently is at the processing stage and is targeting for approval this year. So why is this project so important? So there are few key reasons why this project is so important. So number one, obviously, regional disparities across Karnataka. Some areas still have limited connectivity, especially in the rural and remote regions. So the south regions, anchored by Bangalore and Mysore, are relatively wealthy and enjoy substantially high income levels, better infrastructure, human development outcomes than northern districts. Second, state is increasingly exposed to climate and disaster risks, such as flooding, extreme weather, which affect road durability and access. Karnataka, obviously, it's highly vulnerable to climate risks. So much of its agriculture is rain-fed, making it dependent on the monsoon. Northern districts also face drought and rainfall variability, whereas in the Western Ghats regions, which are the coastal areas, frequently experience floodings and landslides. So the third thing that we feel that is really important for this project is obviously the rural population remain having low productivity and vulnerable to climate risks. And poor connectivities obviously limit market access, increasing losses, especially for farmers. And finally, the existing rural conditions I mentioned earlier are also very, very poor and inconsistent, as you can see on this photo here. So it obviously impacts travel time, cost, and safety. So this project addresses the challenges while aligning also with the government of Karnataka's long-term development vision and national programs like the PMGSY, which is the Prime Minister's Rural Road Program. So overall, the project supports both economic inclusion and climate resilience. So lastly, in terms of objective and expected impacts, there are three things I also want to highlight here. First, it will improve accessibility. Better rural roads obviously will connect communities to essential services such as post-harvest facilities, healthcare centers, schools, and markets. This will help also reduce travel time and costs and improve both livelihood and quality of life of the people in the state of Karnataka. Second, the project will enhance climate resilience. Road designs will integrate climate resilience measures, including improved drainage and elevated road sections in flood-prone areas, helping ensure reliable year-round connectivity even during extreme weather conditions. Third, it will improve road safety that we are also trying to do in this project, which will include safe road design. And we also have a road safety program to try to improve road safety measures close to schools. Other than that, obviously we have targeted measures such as signages, pedestrian facilities, zebra crossing, etc., especially in villages and also near schools to help better protect the vulnerable road users. So all in all, I just wanted to highlight that this project, it helps to deliver rural connectivity, and that is not just connecting, but also providing a more reliable, safer, and inclusive connectivity across the whole of Karnataka. So I'll stop here. Thank you.
Okay, well, that's a very good introduction, thank you, Wilson, into your team's work on the poverty and social analysis. And so I'd like to call on Suresh Kumar and Kavitha Manisanko, who are the PSA consultants for this project, both with huge experience in social development analysis across India and many development bank projects. So Suresh and Kavitha, maybe you can, hopefully you're online and able to present the outcomes of your work in connection to this project. Perfect.
Yeah, good morning all. Good morning, Jeff and everybody. Actually, we have arranged this presentation in two stages. One is the methodology part that will be handled by Ms. Kavitha, and after that, the findings of this our assessment will be presented by me. I think I invite Kavitha to present the methodology part first.
Thank you, Suresh. I'll share my screen first.
Do you want us to drive the slides from here, Kavitha?
Yeah. I hope my slides everyone can see my slides.
Yeah, we can. And you just tell us, okay, so if you just close your screen down, we've got the slides here, and you just tell us when to change the screen, and we'll do that.
Okay.
Just to help your bandwidth as much as anything.
Okay.
So you
just, I can,
yes.
I'm okay.
So you just tell me when, yeah, so you've got your introduction slide there, so go ahead.
Okay. First of all, I would like to introduce myself. My name is Kavitha Manishankar. I'm a social development consultant, ADB individual consultant. I'm from India. And on behalf of my team, I would like to thank Jeff and Wilson for giving us this wonderful opportunity to present our PSA study in this platform. So this is Poverty and Social Assessment, a Karnataka Rural Road Improvement Project. It aims to enhance the rural connectivity, improve access to essential services, and it also supports the socio-economic development of rural communities. So this particular PSA gives us a comprehensive understanding of socio-economic conditions, key challenges, as well as the expected social benefits of this project. This slide, our presentation is organized into the following sections. It provides an overview of project background, assessment methodology, key social issues identified, and major findings. In this slide, you can see glimpses from site. Then the next slide, Karnataka at a glance. Here we can see some key socio-economic indicators of the state, indicating its development status in comparison with average. It is one among the Karnataka is one among the top state economies of India, ranking 5th. Human Development Index shows development in health, education, and living standards, which is 0.519, and whereas it is for India it is 0.547, and population it is 66 crore 10 lakh 95,297 as per the census of 2011. Per capita income, average income earned per person, and health index, it is the performance of the state in health sector. Literacy rate, 75.4%, and poverty headcount ratio, that is the percentage of people below the poverty line. And last, not the least, MPI, multidimensional poverty based on health, education and living conditions of the state. And unemployment rate, it is 2.7%, whereas national average is 3.2%. Importance of PSA. Despite having a strong economy, the state faces several social and economic challenges. Let us now look on some of the key challenges currently faced by the state. Regional disparities. Northern districts lag behind southern districts in income, infrastructure, and development outcomes. Climate and disaster vulnerability. Irregular rainfall, floods, and landslides affects agriculture and rural livelihoods. Then distressed agriculture sector and value chains. Low productivity and poor market connectivity affect the farmers' income and agricultural growth. Poorly maintained roads. Poor road conditions increase travel time, transport costs, and limit to access to services. And the PSA methodology for Karnataka Rural Road Improvement Project shows this slide shows the methods we used for conducting the PSA study. The assessment was carried out through surveys, field, do focus group discussions, key informant interviews, institutional consultations, and surveys. The PSA indicators we used for the selection of districts are multidimensional poverty, agriculture dependency, hilly and forest areas, coastal areas, drought, flood, road traffic fatalities. These indicators we have selected to identify the vulnerable regions and to understand the social, economic issues and environmental connectivity related challenges affecting rural communities. And we have selected, these are the districts we have selected: Kodagu, Udupi, Chitradurga, Raichur, Kalaburgi, Belagavi, Vijayapura, and Chamarajanagar. And we have selected these districts in such a way that it has the representation of each diversities of poverty and social inclusion elements in terms of geographical, social, economical, climate conditions across the state. And from the study, we have collected data both from primary sources and secondary sources. For secondary sources, we have mainly used government reports, census data, and other relevant studies. I stop here. From next, the presentation will continue. My friend Suresh will take over from here. Suresh, over to you.
Thank you, Kavita. And I'm Suresh Kumar Roji. I'm a social development consultant working in ADB as a consultant on PSA. And okay, you can continue, Kavita, that presentation.
Sorry.
Yeah, our approach for this study was identifying the key poverty and social issues of the state and how the project will address the issues and how we can, this intervention to the design changes or some modification or improving the connectivity, how this can enhance the social development, economic activities, and mobility increase. These are the key methodologies we have used for this analysis. And the key findings of our study, we have arranged in different impact channels as discussed earlier. And as per our analysis, we have categorized this study, this project into the second category of poverty reduction and inclusion elements, means IPIE category, with DMF indicators providing that support. And when we are discussing about these prices, we can see that in Karnataka, mostly these rural areas are dominated by the agricultural activities, means around 90% of the people are depending on agriculture. And the main problem, main issues they are, poverty issues they are identifying, they are facing now is the high logistic cost. Means because of the poor road connectivity and the smaller roads, the heavy trucks, those which are transporting the post-harvesting goods, means their agriculture products to the markets are not coming to the farm centers. And then they have to use multiple vehicles. Means first leg they have to use the smaller vehicles to transport and dump it another dumping areas, means for intermediary transport areas. And from there again they have to load the vehicles and take to the markets. This is making a bigger cost expenditure for them, and because they have to spend around 30% of their expense, this transportation expense only for the first leg transportation. If the project, this road is developed, that the multiple loading and unloading can be avoided, and the farmers will get their around 30% increase in their now expenditure. Means they can save that expenditure around 30% is now. Then next one is this inaccessibility tax. Now you can see, because our assessment says that per kilometer traveling for a private taxi in the region is 18 rupees per kilometer. But due to the poor condition of the road, the villages are compelled to pay 50 rupees per kilometer. Means almost 3 times of the rate they are paying now to reach there because of the poor mobility and poor roads. And once the road is developed, they will save around 200% of their expenditure on the transportation, means the local transportation. And welfare access barriers also another scenario. Even though the government is introduced a lot of welfare schemes, including the free access to the free transportation facility for the ladies and subsidized gasoline and so many benefits, but because of the road condition is not good and poor road connectivity, they are not able to access these facilities. And moreover, these gas subsidies, they have to spend more amount for getting their subsidized products at their doorstep. And once the road is developed, that will also be reduced, and there can be a safety for them. And infrastructure benefits, again, we can see that they have limited access to the facilities. And once the road is developed, the access also will be developed. It means access also will be given a good connectivity. Next one.
Kavitha, can you put them to display mode for us, please?
Kavitha, can you?
Yes, Suresh, if you've got only a few minutes left.
Kavitha, can you make it in the presentation mode?
Thank you.
Yeah, next is the price, as we discussed earlier. This is we already discussed. The next one. The access, because as we discussed this, the entire program for the rural roads is 7,000 kilometers, but the ADB funding, it is coming around 5,000 kilometers. That's what so Wilson is explained now. And it is connecting around 15,000 villages and providing the better access to 7.5 million people to the healthcare, education, market, banking, and telecommunication system. And the main scenario, we can see that climate resilience. Our study shows that most of the villages are isolated or disconnected during the rainy season, monsoon season, for 2-3 months. I think the average this connectivity issue they are facing around 15 to 20 days in a year. That is another scenario. And educational barriers because of this. There's access issues, and the students has to travel, means they have to walk around 3-4 kilometers for their studies, art studies mainly. Means every village they have this primary school, but the secondary school they have to walk around 4-5 kilometers in a day, up and down, and that is inviting some type of dropouts in schools. And that once our road is developed, that the human this access to the education institutions can be improved. Then next is critical healthcare gaps, because due to the poor condition of the road, the ambulance, even though it is 2-3 kilometer or 4 kilometer away, the ambulance is taking half an hour, more than half an hour to reach the village. And that is making an issue for these critical health facilities. Mainly during the emergencies, they are finding the problems. And once the road is developed, that access also will be provided, better access to the healthcare services. And administrative isolation, it is clearly visible during our study. Most of the officers or the civil service and civil service societies and these administrative officers are not able to access because of the poor road condition and the isolated situation. And once road is developed, that is also will be improved. And mainly the thing is our 99% of the villages where our rural connectivity has proposed are not available this public transport facility. And the discussion with the transport department shows that once the road is developed, they will provide the public transport facility to each village, so that we can say that 7.5 million people will be getting access in public transport. And public transport, generally, we can say that it is a subsidized rate public transport, and that is also will be a good achievement for our project. Next, Kavita. Yes, back.
If you could finish up in the next minute or two.
Previous one.
Suresh. If you could
Previous
finish
one,
up.
yeah.
Suresh, if you could finish up in the next few minutes, please.
Yeah. Okay, and this is another impact channel we identified. Even though female participation is ensured in the self-help groups and all other civil service organizations, but their influence in the household in decision making is remain limited. And low literacy rate is another scenario. Limited access to the market is also a problem for SSGs to develop some more small-scale economic activities and preventing the border development. Enhanced engagement civil societies is essential to empower these weaker sections of the society. Means once the road is developed, all these facilities will be again getting improved. Next, please. Yeah, this is actually a PSA contribution to the DMF indicators. We can see that there are tribal settlements historically isolated and historically backward due to various reasons like forest approach and remoteness of the villages. And once the road is developed, this is our recommended DMF indicators for our PSA project, that at least 50 tribal settlements will have improved access to healthcare, education institution, and other social amenities. This is one we are recommending from our PSA assessment to DMF indicators for the project. And the second one is just identified from our studies. Second and third, these are key indicators again. At least 1,000 farmers will have benefit from the enhanced access, and around 5,000 dairy farmers, because in the rural area, agriculture is associated with the dairy farming also. And now they are having limited access and to the dairy, mainly the primary collection point. And once the road is developed, the primary collection points will be improved, and they will be getting good access to the markets. Okay, thank you. This is from my side for the key assessment findings. Okay.
Thank you very much, Suresh. Thank you. Yeah. Which perfectly leads into, thank you for both Kavitha and Suresh for that really interesting presentation. And then the connected next step of this is a contribution from Dr. Teja Maladi, who is a GIS specialist, going back to the point that Suresh and Kavitha were making about the access channels of impact. We have some using GIS provide quantitative analysis as a possible tool in this. And so, Teja, if I may bring you in to take us through your slides. Are you happy that we drive from this end? Or
I have the thing already shared, so maybe I can continue from my end. And if there is any issues, I'll request you to shift it to there.
Go ahead. Thank you.
Yeah. Thanks, everybody. Thanks, Suresh and Kavita, for setting this up. And I'm Teja. I'm based in Bangalore. I'm a GIS specialist on this project. So the primary idea of the work that I'm doing is to be able to quantify the impact of the rural roads improvement project that both I think Wilson and Kavita and Suresh have introduced. So the idea is to be able to translate the investment into the roads, into the social outcomes is the whole idea of this, and develop a methodology so that then it can be used for currently what is the impact that is generated, and also that in turn can be used also for the future to be able to use it as a way to select roads for improvement so that can have maximum amount of benefits. So, like I said, the primary objective was to create the framework for quantifying the impact. So we use basically three components, which is the service location. Services can be essential services, hospitals, and other things like what Suresh and Kavita mentioned, education, and let's say cold storage farms and agro processing industries and all of that. And then where people are living and their location, and then roads connecting all of these. So these three are the components that we bring together to be able to do this analysis, where for each of these roads, we kind of bring together all of these data sets together, then do the required processings to be able to run these analysis, to be able to see how much each of these habitations and service locations have access to in terms of time. So which is basically saying that given a road condition, given a hierarchy of road, how much is the speed at which they can travel and to reach a destination within a specific time. And the idea is that given unpaved road improved to a paved road condition, so your travel time increases drastically because you can move at faster speeds. And that's the whole logic of the thing. So once we have the travel time analysis done, then we're able to estimate the accessibility metrics to see which are the areas will have better access before and after, and that's what we kind of do. And all of this is then built into a training module that then the state departments can implement it and continue this further to our current program timelines. So in addition to all of the data collection and all of that, what we are also trying to consider as a key input into the entire model is to be able to see different vehicle types have different kinds of speed. So let's say a two-wheeler can go at a certain speed and a four-wheeler can go at a certain speed. So that's something that we are considering. And then different terrains have different kinds of speed conditions. So a hilly terrain will have less speed limits compared to a flat road, flat terrains and all of that. And there are different kinds of service categories, which is, let's say, education, hospitals and all of that. And then what we are trying to see is what are the conditions before and after a road is improved is what the idea of the thing is. Just to give you a sense of the various indicators, we have, I think Wilson already had showed you a map of the state and kind of give you a sense of which are the places which had different, let's say, development pattern. So this kind of shows you the elevation patterns. The first map on the left will show you the elevation. So it is a very uneven terrain. So there are a lot of districts in the state, especially towards the south, where there is a lot of hilly terrains. And as what Wilson was saying, these areas would see a regular events of landslides during monsoons. And as what Suresh was saying, there is a lot of disconnectivity during the monsoons if there are unpaved roads due to landslides and all of these conditions. And then what we have in the center is the DRRP network, which is basically the road network. There are a couple of gaps, 2 districts are gaps, which we will update later. But the idea is to show there is a different levels of road connectivity starting from national highways, state highways, major district roads and village roads. These are the classification that the government of Karnataka adapts, and that's what we are also trying to use it for it. That thing. And then on the right side, you see habitations. So you see various habitations, and this is currently not visualized by the population sizes and all of that, but just to kind of show what is the scale in which that we are operating these. And then the other set of services that we were talking about, where there are medical services, then agriculture-related services, transport, let's say bus stops and all of that, and also admin categories, which are government offices and all of that. And the last one is education. This also includes, let's say, from primary schools to secondary schools to university level colleges and all of that. So that's all of these are what is basically what we are referring to as service locations, with several subcategories to it. So combining these three is what we are kind of trying to say as quantifying the overall impact of the thing. So what we're trying to do, as I was saying earlier, not just developing an analysis and handing over the results, we are also trying to develop a method that then can be replicated by the state and various departments later for doing these analysis. So we have developed, so we are currently developing the methods using an open source tool called QNeat 3, which is a QGIS, which is an open source software. QNeat 3 is an open source plugin, and it is a direct use of these plugins, and people and the officials can replicate this later. So that's the core of the entire process. And we're not supplementing the data sets with other publicly available data sets. We are trying to use whatever the government department is already using it for their estimations and all of that. So we are trying to use that so that it can be replicated after all of that is being done. So what we're trying to do with our QNeat 3, just to visualize or the map on the right, you see several points. So each of these polygons that are radiating out of this point is what kind of visually represents the area that is covered in a specific time frame. So from a point closer to thing is where you can reach in, let's say, 15 minutes, then 30 minutes, and 45 minutes, and let's say 1 hour, 1.5 hours. So as you go out far away, the distance, the time taken is then measured. So each of the polygon is then generated, and that can be then used to see which of the services are within these. And if you flip it and consider these points as, let's say, service locations, then you will see which are the habitations which are going to fall within this. So that's the whole idea of the approach simply. While referring to the earlier side where we were considering various kinds of speeds and vehicles and terrain and all of these. So this kind of is summarizing. I will go into the detail of this, but the idea is to see different road hierarchies have different kinds of speed limits based on the paved and unpaved conditions. And then you have various speeds to these. And once the road is improved, the speed of this road is improved, and that's what is the last column that is going to is representing. So the first thing that we see, let's say a village road, which is an earthen thing, which is unpaved, so we'll have a lot of issues in terms of speed in various conditions. So you would only have, let's say, 20 kilometers per hour thing as an estimated speed. In a flat terrain and then hilly terrain, there's a further reduced speed. And four-wheelers, which are a little bit more stable, could have a little bit higher speeds. That's what the 4 speed columns indicate. And then as this road gets improved, the speed improves to, let's say, a main district road level, which is a paved road, which is, let's say, something like a 40 kilometers per hour for a two-wheeler. So if you visualize this on a map, what we're trying to see is the map on the right will show you a quick representation of what we're trying to do. So you see this, the plus icon, which is a public health center located in Raichur district, one of the backward districts in the state. So what we are planning to do is, and then the green lines that you see is the roads that are selected for the improvement. So you have a regular road network, and then you see these 2 roads that are selected for the improvement as part of this phase of the project. Then there are 4 polygons. So you see 2 polygons with a blue line and 2 polygons with a red line. So what you see, the blue polygons, the center, the innermost polygon is what shows the 15-minute travel time from the PHC outwards. And the larger polygon with the blue line shows a 30 minutes travel time from the PHC outwards. So this is what the current condition of the, based on the existing conditions of the roads. Then considering the improved road conditions, where then you have improved speed limits. So then what you see is the innermost red polygon is what is the revised area that is reached within 15 minutes from the PHC. And the 30-minute limit is what you see here. So translating this into a quick summary, what you see is how many the time limit is before and after, what is the habitations and population covered. So what we're seeing is that around 15 habitations which were in 30-minute limit before the road improvement are now going to be falling within 15 minutes of the PHC. So that means that around 12,000 people living in these places will be able to reach the PHE within 15 minutes, which was more than 15 minutes earlier. And the second thing, let's say, for example, is around 14 habitations which were outside of the 30-minute limit are falling within 30-minute access to the PHC. So if this then can be scaled to all the other service locations, let's say educations, let's say hospitals, or switch that into habitation and see how much of the habitation have access to, let's say, market centers, public transport, and all of the administrative centers and other things. So you'll be able to kind of get a sense of what is there before and what is there after, and how much is the impact that each of the road that is invested is translating into social outcomes. So I'll stop here, and I'm happy to take any questions that there in the crowd. And thank you again for the opportunity, and look forward to discussion. Thanks.
Excellent, Teja. Thank you ever so much for that. And for, and timing-wise, the chair, me, unfortunately, is very bad at keeping time, but it's just too interesting, and that's my excuse. But yes, any very last questions? I'm conscious that this is our last session, but any last questions you'd like to ask? Yeah.
Yes, good afternoon. Good afternoon. I'm Paul from Drive Safe campaign, Drive Safe India campaign. Yes, I'm running a Drive Safe campaign in India. I'm trying to capture, what I'm trying to capture here is the condition in India, wherein we have 170,000 fatalities a year. It coincides with the development. Okay, but I don't see there is the investment, social preparedness investment, when it comes to educating the people on this, the safe road use aspect of development. Because what's important is, we have all these initiatives that we're doing that is very good, very nice for everyone, for access. But we have to remember that we are measuring the impact of access and safety. So on the safe side, or the, what do you call, the soft investment of social preparedness development, what's our program here, and what's our measure that this developments won't add to that numbers, to the fatalities and
Wilson, did you want to say something very briefly? You've got community safety awareness in your...
I'll try to respond to your question. So under the KRRP project, there are a couple of soul safety sort of implementations that we try to do. One is, in a lot of transport projects, we try to do IRAP. And that is one of the initiatives that we're trying to do in the rural. In the state road context, it will be easier, but rural road, we still try to have some star ratings for these rural roads. So to make sure that all these roads, the qualities and all that are safe. The second thing we also try to do in our rural project is that there's another school project that we're doing under ADB, that we're updating some of the schools in the state. And we try to identify actually rural roads that are connecting to these schools. And while identifying these roads, we have some kind of road safety improvement program, just to make sure the safety of students going to this school will also be improved while working on this rural road project. So this project is still in the early stage, so we don't have any specific indicators for the time being. But based on this measure, we'll make sure that these indicators and all that will be included in the DMF to make sure all these measures are being implemented by the agencies. I hope I answered your question. Thank you. Yeah, please.
Yes, sir. I understand and I appreciate all the road safety measures that we are implementing. with regards to the development. But what I'm concerned with is that in the data, 90% of the fatalities or 90% of the accidents are caused by human error, not by the infra that we implement. So on the soft side, that's why I'm making this campaign, because it's an initiative that I do, that because I see that the people, all of this, the infrastructure that we're doing is good, but if the people, the society is not ready, I always tell this, it is as if you're giving a gun to a 10-year-old that doesn't know how to do it and doesn't know how to use it. I've been in India for 10 months, and people are, yeah, well, it's really, when you're crossing, it's a run for your life there. So it's more on the human factor that we have to invest on. Behavioral, yes.
Okay. Duly noted. Thank you. Yeah. Any other questions? Yeah.
It's a more general question, but I'll just put it here. Emily showed that how she did the DMF. So my basic question is, when you do the PSA, you find out that in the case of Emily's one, you said that project has 3% of women drivers. And then you put a target in the project saying that 30% of women labor participation, something. On what basis you define that 30%, and how does this PSA works? Because sometimes it's not compatible with the overall project timeline and frame. Yeah.
Maybe you can ask Suresh with regard to the India project, if that's okay. Suresh, you mentioned, or you recommend some PSA indicators. Do you want to take us through some of the rationale of the levels and the measures for those indicators? I think that was the question, that how do you translate this, the analysis into sensible levels in the DMF indicator? Suresh, are you still there to do that?
Oh, yeah. Actually, that indicators we generally finding out from the analysis only. But the question what he's asked about this women participation in the job profile. But I think that is something different we have not added in our study, because this is something we are not even identified, because sometimes it is very difficult to judge in the it is a very, very preliminary stage now our assessment is going on. That is what we have not really done that parameters. But whatever we have developed indicators is from our analysis findings.
Yeah, okay. I think that's the answer. It's from the analysis findings, depending on, and that Emily's, Dr. Wang's not here to answer with regard to the element, but it is a general question. But it's from the analysis that you set that level. That you've done. You have to have evidence to support that level, and that's how the PSA provides the analysis to set the level in the DMF. That's yeah. Any further questions? I'm conscious that we are 5 minutes late. Any last questions from anybody? Okay, so if we can thank our presenters for this morning and those of us left, thank you for your participation. Thank you for your contributions to the forum this week, as we are the last one. So thank you very much for that.
Thank you.
Thank you.
Thanks for that, guys. Thanks very much.